If you're a financial advisor, you may want to watch this video because I'm going to talk about a financial exposure that may be happening to your clients that you know nothing about. My name is Jamie Pripp. I'm an independent insurance broker. I work with a lot of financial advisors to be their Medicare guy. And I've noticed a trend lately that a lot of financial advisors don't realize the financial risk that people transitioning to Medicare face. A few years ago, Fidelity actually did a study and they found that the average couple, once they are on Medicare, are exposed to $300,000 worth of medical expenses. And you may not realize this, but that number has actually gone up. It's even higher in 2023. I'm going to share this story with you here from money.com. It's called, "You'll Need Way More Money Than You Think for Healthcare Costs in Retirement." And right at the beginning of this article, he says, a 65-year-old couple retiring this year, this was 2022 by the way, can expect to pay an average of $315,000 on healthcare expenses throughout retirement. And this is according to the latest retiree healthcare cost estimate, again by Fidelity Investments. That's up 5% from the 2021 estimate of $300,000 and nearly double what it was 20 years ago when Fidelity first began the annual study. The 2022 retirement healthcare cost estimate for single retirees is $150,000 for men and $165,000 for women. Fidelity's estimate assumes a heterosexual couple where both members are enrolled in traditional Medicare, which between Medicare Part A and Part B covers expenses such as hospital stays, doctor visits and services, physical therapy, lab tests, and more, and in Medicare Part D, which covers prescription drugs. The total includes Medicare premiums, co-pays, and out-of-pocket services that Medicare doesn't cover. So one of the biggest things that you need to know about Medicare is that it does not cover 100% of a retiree's expenses. It covers 80%. So there's a 20% gap in coverage and there's no cap on that. So think about something major happening. I just went and visited someone in the hospital who had to have bypass surgery. So on Medicare is going to pay 80% of that bill, but the 20% is going to come to that retiree or Medicare beneficiary. And if there's no cap on it, as you can imagine, that can be extremely high. So let's skip down and just look at some more of this article. He goes on to say, Americans don't expect healthcare costs to be so high. Despite these daunting numbers, Americans generally are not aware of what healthcare costs will be in retirement. In fact, once presented with Fidelity's study, 70% of respondents to a recent survey say they feel unprepared to cover healthcare expenses during retirement. But there's some good news too. 47% of those with a health savings account believe they are prepared to cover healthcare expenses in retirement, compared to 27% of those without one. So I just want to skip, I don't want this video to be too long, but I want to skip towards the end here in what he says. At the end here he says, Medicare education is critical. About 57% of baby boomer respondents, ages 58 through 76, incorrectly believe they can sign up for Medicare at age 62 and receive reduced benefits. While this is the case with Social Security, Medicare benefits begin only at age 65 and you have a 7-month window to enroll. That time frame begins 3 months before the month you turn 65 and ends 3 months after the month you turn 65. And as you can imagine, healthcare costs tend to mount the older that you get. Without supplemental Medicare coverage, there is no limit on out-of-pocket expenses under traditional Medicare. Now listen to this. 41% of boomer respondents are unaware of this key fact. But retirees can benefit by enrolling in a Medicare supplement plan, also known as a Medigap, in order to still limit their out-of-pocket expenses in exchange for a predictable monthly premium. So again, this is just a an important thing for you to know if you are a financial advisor, that there is this large exposure that your clients potentially have financially if they don't truly understand the Medicare program. So if you don't have someone that you can refer to around this subject, I would be happy to have a conversation with you about how I might be able to help. And if you want a link to this particular article that I shared in this video, just send me a message. I'll be happy to pass it along to you. And if you have any questions, feel free to leave me a comment below. Thanks so much for watching. Have a great day.